Hi, I'm here today with Dr. Aaron Oxenreiter and has been studying health and wellness since 1995. We're here to discuss his latest report on leaky gut and bad bacterial overgrowth. Dr. Aaron, just what is leaky gut and what is bad bacterial overgrowth?
Well, leaky gut and bad bacterial overgrowth is basically an imbalance in the gut. Due to improper diet is the main cause. But your body was designed to have a certain amount of bacteria so it can digest and process your food. And because of our lifestyle now, the Western diet, a lot of us are deficient in that or actually have an overgrowth of what's bad, called bad bacteria.
Okay. Now, what are the symptoms for leaky gut?
The symptoms can be pretty severe and vary quite a bit. It can be headaches, diarrhea, inflammation, inability to sleep, are just some of the most common ones. But it can also start to affect your thyroid, your liver, your kidney function, and present as kind of odd symptoms that nobody is quite sure where these are coming from because they don't show up on a traditional test.
Okay. Now, is this something that could be a genetic condition? Is this something we inherit? How do you get leaky gut?
Not necessarily. The research I've read shows that genetics has changed less than 200% in 40,000 years, or since the Adam prototype. So basically our genes are the same. What's different is our way of life, how we eat, how we exercise, and how we think. So genes does not play a role in this.
Now, if I have leaky gut, what should I do about it?
Well, the only way to really detect it is through specialized testing. The functional medicine assessment is a good way to determine if you have this condition. A series of tests will show, if your body's not progressing to a normal regime or treatment, that you may have this condition. So it points us in the direction for the testing we need to do.
Okay, now you said functional medicine testing. Can you tell me a little bit more about
Sure.
that?
Functional medicine testing is similar to the medical testing we use today, except it gives us information before disease shows up. It's like the smoke alarm. Typically,
Okay.
when you do a blood test, a disease shows up. Well, the functional medicine is designed to show us what's going on before that happens so we can catch it early.
Okay, so we can catch it early. Can you also treat it?
Absolutely. As we say, it's better to treat the cause rather than the symptoms, and functional medicine is based on finding and fixing the cause.
I get tested and I find out I have leaky gut or bad bacterial growth, or God forbid both of them. What can I expect my life to be like?
Symptoms can be very severe to the point where people can't even get out of bed or walk, such as Crohn's or inflammatory bowel disease, which is basically just a whole condition of conditions in the bowel. But it can be from completely debilitating to just a nuisance. Fatigue, malaise, a variety of symptoms.
That doesn't sound good at all.
It's not. It's very unpleasant.
So let's say I have this illness. How much time, money, what's things going to be like for me?
To treat it or to deal with the symptoms?
Well, let's say I'm just trying to cope with life and get through the day on a regular basis. What am I looking at?
Just trying to cope with it and not really fixing the symptoms or fix the cause will be basically a lifetime type of treatment. You go through up and down cycles, different kind of sicknesses or illnesses may present, so it could be actually a lifelong battle.
That doesn't sound good either. Does this ever cure itself or fix itself?
It does not. Like most process of the body, unless there's an intervention to help reverse it, it only progresses.
Okay, so I can't sit around and just try to rest and hope this will go away.
Correct.
So I decide I can't live with this. This is too much for me, for my life, for my family. What do I do?
What you got to do is find out what the cause is. And the cause is found through the functional medicine assessments, because that's the only way to truly find out what's going on. And once we establish what kind of dysbiosis, candida, inflammatory condition you have, different ones require different treatments. But first we must, remove the bad, repair the tissue, and then replace and replenish the normal growth. So it's a lifestyle thing. The way you eat, the way you're going to exercise is all going to play a part in this.
Okay. Now, is it going to take a long time to fix something like this?
Fixing the cause usually does take a while. I like to tell my patients or my clients it's going to take between 3 to 6 months, sometimes a year, to actually heal from something as serious as this condition.
Okay, so if I don't fix it, then I'm looking at pretty much a lifetime of medication and dealing with whatever pain or symptoms. If I do fix it, I'm looking at 3 months to a year to hopefully correct that and get back to normal.
Depending on how severe it is, yeah, absolutely.
Okay.
The body has a great ability to heal, but unfortunately things like that do take time.
Okay. Well, it sounds to me like it's a lot less expensive and a lot less painful to treat it as opposed to just trying to deal with it.
Absolutely, because you're looking at the quality of life issue as well. You know, the quality of life you're going to have after it's fixed is going to be much greater than dealing with a lifetime of symptoms.
That's awesome. Well, thank you so much for your time
Thank you.
today. Look forward to talking to you soon.